Welcome, everyone. This is the CDOC Evaluation Webinar. We're going to go ahead and get started. My name is Shante Davis Patterson, and I'm the Program Director for California's Comprehensive Cancer Control Program. And we administer this the Cancer Coalition, CDOC, or the California Dialogue on Cancer. Thanks for being with us today. So the purpose of the webinar today is to communicate key results from the Comprehensive Cancer Control Program Evaluation Report. And I want to note that this is fiscal year 24-25. We're always a little bit behind on the evaluation just because of the time it takes to turn it into CDC and also get our California Department of Public Health approval for the report. And also, I wanted to note that the purpose of our evaluation is to also determine the impact of our selected program activities related to the Comp Cancer Program and CDOC and our cancer plan. Also to provide accountability to our funder, CDC, and also to the California Department of Public Health, the CDOC Executive Committee, and of course, all of you. And then we also utilize recommendations from every single evaluation to improve program implementation and coalition administration. So we always take those recommendations and take them into account as we're planning for the coming year. And then we also want to increase the broader cancer control community support for our coalition and CDOC. All right, so our evaluation team and staff, we have an evaluation team that's made up of the Comp Cancer team, of course, and then we also have some of you who are in the coalition who have volunteered. And we're always looking for volunteers for our evaluation team. So if you're interested in serving on the CDOC evaluation team to help do some analysis, data collection, report writing, pulling this type of webinar together, let us know. We're always taking new members on our evaluation team. But I also want to thank all of our evaluation team members for helping with all components of our evaluation. All right, so a little background. This webinar is being developed in response to recommendations from the evaluation report 24-25. And as I said, we're always looking at our evaluation recommendations and we're putting them into practice. We're implementing those recommendations that we get to improve our program. And this webinar is sharing evaluation results to provide accountability to the public and CDOC membership, as I mentioned before. All right, so our evaluation design, we do follow the CDC's Comprehensive Cancer Control Branch Program Evaluation Toolkit. CDC has all cancer programs follow this toolkit, and this is the one that we use. So our design focuses on 3 areas. And it's always broken up into these 3 areas, the 3 Ps we call them. The first one is the plan, which is the state cancer plan. It assesses communication and findings, measures action plan achievements. And so with this segment for the plan, I want to make it clear that we're not assessing all of the measurable objectives that are included in the cancer plan, but we are, again, focusing on other things like dissemination, the communications, findings, etc. For the program, we measure program successes, implementation, and utilization. And then for a partnership, we are gauging engagement opportunities and gaps in membership. And when we talk about the partnership is the coalition, it's CDOC. And let me go back to and say that the program is the Comprehensive Cancer Control Program. And actually, can you go back one really quick? And I just want to note a small error on this slide. What we're measuring for the plan is our dissemination, the success in dissemination. So the plan and the program is a little backwards here. And then we're also measuring for the plan implementation and utilization. And then for the program, we're measuring our action plan achievements. And you'll see that outlined as we go through the webinar. So our evaluation design, our data collection tools. So this evaluation used a mixed methods design. So we had qualitative and quantitative data. And it was sourced from the Coalition 2025 Annual CDOC Member Survey. And many of you have consistently been answering this survey for us, and we thank you because it does help us with this evaluation. We'll have our next 2026 annual CDOC member survey is coming up soon at the end of this month. And then we also did some key informant interviews for this evaluation. Limitations for our evaluation, we had a low response rate at 18%. And even though this is a low response rate, it is actually one of the highest response rates that we have had historically for our evaluation. But nevertheless, it still is a limitation with the low response rate of 18%. Our membership survey had 44 responses out of 246 individuals that are in our coalition. But we did have over 100 starts, but they did not finish. So again, our number that completed our survey for us is 44. And then also we did have some inconsistent participation and conflicting schedules for our evaluation team members, which happens, sometimes. So that was another limitation that we had. All right, so now I'm going to turn it over to Brittany.
Thank you, Shantae. Next slide, please. Next slide, please. All right, the Comp Cancer program evaluation is broken down into three areas, so program plan and partnership. Each area includes at least one evaluation question, data source, and analysis. And the three focus areas are in alignment with the required 5 strategies in the 2022 to 2027 CDC grant award. So here is the program question. The program questions had the goal of assessing effective communication of the evaluation report and findings, as well as measuring the achievements of the interventions in the Comp Cancer Program Action Plan. So the program questions are, did CCCP develop and implement an effective evaluation dissemination plan? And how many interventions did CCCP accomplish in its action plan? The plan question of the state cancer plan focused on the CCCP preparing to ensure that the 2026 to 2035 state cancer plan reaches an audience outside of the coalition. So here's the question. Did CCCP facilitate the development of a curated list of partners outside of CDOC to disseminate the new cancer plan to? The partnership component of the evaluation was assessed through gauging engagement opportunities and coalition opportunities for both new and existing members. And so the following questions were, did the Comp Cancer team identify levels of membership engagement opportunities for new and existing CDOC members in order to improve their understanding of coalition engagement options? And did Comp Cancer implement a coalition orientation for new and existing members that improve their understanding of coalition functions, activities, and the current cancer plan? And now I will pass it on to Sheila.
Thank you, Brittany. Hi, everyone. So I'll be walking you through the evaluation findings connected to the questions Brittany just reviewed. And because we are presenting in June 2026, the dissemination examples I'm about to share reflect the completed evaluation cycle related to the fiscal year 2023-2024 evaluation findings at a glance, which was released in March 2025 and informed our work throughout that reporting period. So for the first program evaluation question, did Comp Cancer develop and implement an effective evaluation dissemination plan? The Comp Cancer program developed a multi-pronged dissemination plan to make evaluation findings accessible actionable, and widely shared. So this approach was part of the broader fiscal year 2024-2025 strategy to strengthen communication and transparency across the coalition. The evaluation findings at a glance provides a snapshot of year 2023-2024 evaluation questions, key findings, action plan progress, and feedback from the coalition members. It is produced every summer and it goes through internal review in the fall and must be made ADA compliant before release. So, a process that can add several weeks and delay publication by up to 6 months. Hosting an evaluation webinar was one of the strongest recommendations from the year 2023-2024 evaluation, highlighting the value of walking members through the findings in real time. So in response, our Comp Cancer program hosted a CDOC evaluation webinar on June 5th last year to highlight major findings and explain how we track progress. And because of this approach was well received, we are continuing the practice again this year to share each fiscal year's findings. So the webinar demonstrated how evaluation informs planning, supports collaboration, and drives continuous improvement across Comp Cancer Program and the CDOC Coalition. So evaluation findings were additionally shared during CDOC work group meetings, just to ensure that alignment with ongoing initiatives and to encourage member feedback as well. So this layered dissemination approach reflects the program's commitment to transparency, learning, and continuous improvement, as I mentioned earlier. So the next program question asks, how many interventions did Comp Cancer accomplish in its CDC action plan? So progress across the Comp Cancer action plan varied because many objectives require long-term policy systems and environmental, or what we call PSE, changes. So these objectives are designed to meet outcomes by the end of our CDC grant period in year 2026-2027. So the yearly progress reflects benchmarks rather than final impact. So in the next few slides, I'll share the progress made from last fiscal year reporting period. So in strategy 1, enhance NPCR data quality and dissemination, 1 out of 3 deliverables were completed. Comp Cancer completed 1 major deliverable by hosting 4 cancer surveillance data webinar series during the reporting period. The state cancer plan dashboard, however, was not updated during that fiscal year due to delays, and the 2023 progress report was not released, but a new progress report is planned for year 2026. Next strategy is the use of surveillance systems and population surveys. So 1 out of 1 deliverable was completed. Comp Cancer successfully disseminated 1 California Cancer Registry report and 1 Behavioral Risk Factor Surveillance System report, meeting the full objective for this strategy. Next, strategy 3 is to support partnership for cancer control. So 1 out of 2 deliverables were completed. The CDOC Cancer Centers Collaborative met 4 times, convening topics such as the lung cancer screening, oncology financial navigation, and cancer burden in Native American communities. A planned cultural competency training was not delivered due to compliance requirements under an executive order. So for strategy 4, deliver screening and implement EBIs. 0 out of 3 deliverables were completed. The PSE objective, like I mentioned earlier, is still in progress. So for example, the HPV vaccination, which is the Announcement Approach Training, or AAT, no new health systems formally adopted the AAT during the fiscal year 24-2025. But Comp Cancer increased outreach to CDOC listserv announcements, the HPV Vaccination Learning Collaborative, and other partner work groups. 1 AAT session was delivered on March 28, 2025, and it trained at least 19 folks. However, the HPV Learning Collaborative delivered 4 sessions, reaching up to 254 attendees statewide. For the colorectal cancer screening activity, Comp Cancer continued collaborating with DHCS, C4, or the California Colorectal Cancer Coalition, and ACS to support medical plans in adopting CRC screening evidence-based interventions or EBIs. During that reporting period, planning advanced for an educational webinar focused on implementation of EBIs such as provider reminders, client reminders, and assessment feedback. Through the Breast and Colorectal Cancer Screening Implementation Project, or the BCIP partnership, 8 federally qualified health centers completed Cycle 2, and then 7 federally qualified health centers began Cycle 3, implementing EBIs like text outreach, reminders, patient navigation, and reducing structural barriers. For the Cancer Survivorship Activity, which is the CHW Promotora Certification Track, CompCancer continued refining the plan for a specialized cancer care track for CHWs in partnership with DHCS and the Survivorship Work Group. Progress has been slow due to coordination challenges across multiple agencies and capacity constraints, and due to that slow traction, CompCancer is now considering expanding partners to help identify the most feasible path forward. For the last strategy in our CDC action plan, conduct program monitoring and evaluation. One out of one deliverable was completed. All objectives were met, producing the 2024 evaluation report and the 2025-2026 evaluation plan and disseminating evaluation findings. CompCancer continued partnering with the CDOC evaluation team and an intern to conduct data collection, analysis, and key informant interviews. Next, I'm highlighting our findings for the plan questions. Did CompCancer facilitate the development of a curated list of partners outside of CDOC to disseminate the new cancer plan to? So CompCancer developed a curated list of partners outside of CDOC as part of the dissemination strategy for the new state cancer plan. So the curated list is an early step toward building a comprehensive dissemination plan for the plans released sometime in 2026. To gather input from the state cancer plans contributors and subject matter experts, CompCancer launched the What Can You Do survey on May 29, 2025. So the survey helped us shape state cancer plans implementation guides that is tailored to different types of cancer plan users. So while the survey did not collect names of specific organizations or partners, CompCancer plans to gather more detailed information as disseminating planning continues. So the overall goal is to ensure dissemination efforts are inclusive, targeted, and responsive to diverse audiences that will use the state cancer plan across the state when it's finally released. CompCancer reviewed potential dissemination audiences, especially those outside of CDOC, during our CDOC Executive Committee meetings that were held in March and June of last year. And those discussions help us identify who should receive the plan and how broadly it should be shared and what level of support different partners may need. And now I'll pass it back to Brittany, who will highlight the findings in partnership questions.
Thanks, Sheila. So this question asks, did the CompCancer team identify levels of membership engagement opportunities for new and existing CDOC members in order to improve their understanding of coalition engagement options? So the CompCancer team identified multiple levels of membership engagement opportunities for both new and existing CDOC members. And these opportunities included participation in CDOC work groups, networking events, and professional development activities such as educational webinars and in-person meetings. Members also benefit from access to exclusive content like the CDOC listserv and comprehensive cancer updates, as well as opportunities to spotlight their organization's projects and engage in industry-specific knowledge sharing. Findings from both the general member survey and key informant interviews suggest that CompCancer has implemented orientation efforts that are effective in improving members' understanding of coalition functions and activities. From the general member survey, 43% of respondents reported attending a CDOC orientation webinar, and all of whom that attended indicated that the orientation improved their understanding of the coalition's structure and work. and 80% also said that they learned something new. Satisfaction with the orientation was also high among survey respondents. Of those that attended, 11% reported being very satisfied and 31% satisfied. No respondents expressed dissatisfaction. However, 56% of respondents, as Shantae mentioned, did not attend the orientation, suggesting a need to expand outreach or accessibility to ensure more members benefit from this resource. And now I will pass it back to Joyce to talk about evaluation recommendations.
Thanks, Brittany. For our program recommendations, we're focusing on two key improvements. First, for program is partnering more intentionally with the American Cancer Society, or ACS, and cancer centers to reduce barriers to adopting HPV and colorectal cancer evidence-based interventions. This would strengthen their partnership and help us get interventions implemented more effectively. Second is shifting coordination of the community health worker, or CHW, and Formothorus Cancer Care Module project to ACS or a similar intermediary. This would help reduce delays and make implementation faster and smoother. Next, for the plan recommendations, we're focusing on strengthening how partners use the state cancer plan. So first recommendation was piloting the state cancer plan implementation guides with a small group of partners. This will help us make sure the guides are practical, user-friendly, and aligned with partner needs before rolling them out more broadly. Also integrating simple structured feedback loops like short surveys or quarterly check-ins so partners can easily share how they're using the plan and what support they may need. This ongoing input will help us continuously improve the plan's usefulness and impact. And then for the partnership, we're focusing on expanding how we support and engage coalition members. So sharing the CDOC orientation content more frequently and multiple formats like webinars, videos, and short guides, and promoting these through the CDOC listserv, partner newsletters, and social media. This will ensure that the orientation materials are easily accessible for partners to access whenever they need them. Additionally, launching a member voices series or informal lunch and learn sessions where coalition members can share how they're applying CDOC goals in their local work. These real world examples help others see practical applications and strengthen our sense of community. For membership and partner engagement, the CDOC team has been sharing these opportunities through our listserv and webinars. These are some examples. We regularly promote the Join CDOC overview, including a short informational video that introduces who we are and how to get started. We also have been sharing ongoing opportunities to participate in CDOC work groups, such as the colorectal cancer, survivorship, health access and disparities, lung cancer screening, and the California HPV vaccination roundtable. Through communications, members have continued to hear about networking opportunities and professional development sessions, including webinars, in-person meetings, and events. And we also use the listserv to provide access to exclusive CDOC and program updates, educational resources, industry specific knowledge sharing to support members' work in cancer prevention and control. Overall, our goal has been to consistently make it easy for members to plug in, learn, connect, and contribute in ways that best fit their needs. And so respondents consistently have highlighted the value, impact, and uniqueness of CDOC. Leadership noted that CDOC's longstanding regional coalition model works because it fills a critical need for the coalition across the state. Members describe CDOC as a rare space that brings together experts from across California, creating opportunities that don't exist elsewhere. General members praise CDOC's proactive communication, especially around funding, networking, educational resources, and webinars that keep partners informed and equipped to better serve their communities. Many emphasize how helpful CDOC's materials are for patient education and program support. Lastly, the workgroup accomplishments were also strongly recognized. Respondents pointed to the Health Access and Disparities workgroup as particularly successful and timely, especially giving shifting priorities, while also highlighting the high impact of the colorectal cancer workgroup. Together, these reflections underscore CDOC's role as a trusted, knowledgeable, and collaborative statewide leader in cancer control. And now I'll pass it to Shantae for some questions.
All right, thank you, team. That was a lot. So we're going to pause right now, or we actually have come to the end of our webinar. And so now we're pausing for questions, if anyone has any questions. One thing I will note for clarification is that in the evaluation process, when we evaluate the program, we are evaluating the Comp Cancer CDC action plan. And so that is different than all of the activities that we have going on within CDOC. The evaluation purpose in terms of evaluating the program is just to look at those activities that are in our action plan. And I just say that to say that we do a lot more outside of the action plan. So there are a lot of things going on in the coalition. And as you heard, throughout the webinar, with the work groups and things like that. I see a hand up, Lucinda.
Thanks for this great information. I really appreciate it. I just have a quick question. You said 100 people started the survey. I was wondering if there's an automated email that's sent out that says, okay, you started, do you want to finish? Because I think that would really bring up, the participation. I'm just wondering why such a large start and stop.
Yeah, we don't have an automated email that goes out after that, but I think it's a great idea for us to actually to just generate one. We can do that. So
Yeah.
thank you for that. Thank you for that wonderful idea because yeah, it is sort of a missed opportunity there. So I think that that's something that we can do for this year's evaluation. So thank you very much, Lucinda.
You're welcome.
Any other questions from anyone else? And I don't see any in the chat here. I'm just double checking. Okay, well, I want to thank you all for attending the webinar. I do have some announcements, so don't leave yet. I want to go over some announcements. And also, Joyce, if you can drop the evaluation in the chat right now, if please help us evaluate the evaluation webinar. We before you hang up, because there's some minutes left in the hour here, please do start that evaluation for us. As you see, we do really take all of the feedback here and use it. All right, so for our announcements, we have a surveillance webinar coming up on the 17th. On the 17th at noon. Our HPV vaccination learning collaborative, our summer session for July is coming up July 15th at noon. Our face-to-face, this is in-person 2026 CDOC biennial member engagement meeting is coming up September 14th on a Monday. It's a Monday, so please put it on your calendar. But this is in person downtown LA at the California Endowment. We should be having some registration information and scholarship information available in the coming weeks. We're still working on getting all of that together, but please save the date for that. And then, as I mentioned, our CDOC 2026 CDOC General Member Survey will be coming out. And again, please help us fill it out. We'll be employing that suggestion from Lucinda, in terms of getting those completes there. And then lastly, if you are interested in helping this team, helping with the CDOC evaluation team, please email us your interest at cdocshare@gmail.com. Or for those of you who know the CDOC team and have our emails, just email us. And lastly, again, please help us evaluate the evaluation webinar and complete our evaluation. Get involved with CDOC. You can get involved through our work groups, other coalition efforts. There's our website there, cdoconline.net. And you can always send an inquiry to us as well through our Gmail. All right, well, thank you all again for attending. And we hope to see you this summer at some of our events and at our meeting in the fall. Thanks, everyone.
Thank you.